Hello, my name is Anaida Ramirez, and today I'm going to be speaking about ABA therapy and my experience within the field of ABA, as well as teaching you guys maybe one technique that I have been taught and currently I am using with one of my kiddos. ABA is essentially known as Applied Behavioral Analysis. It is an approach based on evidence and science that targets behaviors with those with autism. Specifically, ABA is for autistic children. I work with kids from 1 to 6 around there. And not only that, but where I work, we have expanded to what we call a teenage program. So that allows older kiddos to come in and also be able to learn and be helped by us. There are 7 dimensions of ABA. Now I'm going to be looking a little bit this way. I have my 7 dimensions on the screen. The first one is generalization. It basically helps kids use what they learn in various settings and situations. The second one is effective. It basically ensures that the methods that we are using works to be able to get those to acquire skills. The third one is technological. It is just having a clear plan and treatment and making sure that everyone is on the same plan, especially the parent. Where I work, we like to always make sure that the parent is on the same boat as our BCBAs and the RBT. The fourth one is applied. Focuses on implementing skills that they already know within their environment and society. So if they already know something, we may apply it to something else that helps with that skill. The fifth one is conceptually systematic. It is a collective understanding of the science behind the behavior principles. The sixth one is analytic. It focuses on ABA providers and making sure that our services work with data. We take data almost every day to ensure that what we are teaching them, what we are working with them is helping, because if it is not, then that is when the registered behavioral technician, also known as an RBT, and their BCBA, which is also the board certified behavioral analyst, get together to come up with a different plan and maybe just have a backup plan, see what else we can do to help that kid. The sixth one is behavioral. This is huge because that is where we come in and we work to observe and measure the behaviors to create a treatment, or we just observe and measure to see how those behaviors are currently going. And that is the 7 dimensions of ABA. Now, my technique that I am excited to show you guys because it works. And most of the time we apply it with those kids who can speak but just don't know how to request in a full sentence, only say like one word and max. So I have a cow today, a cow toy. Let's say that my kiddo sees a cow toy on the counter and they want it. They can't reach it, however, because they are too short to reach it. So I observe them and I'm seeing that they are trying everything in their power to try to climb and grab the cow toy. So I asked them, hey, do you want the cow toy? Like, what do you want? And if they're just pointing or just, I see that they're collectively just trying to grab this, I'm like, oh, I want cow. So that way I'll grab the cow, I'll have it to me, I'll make sure that they're looking at me, because if they are not looking at me, then the whole target just goes out of the window. You want them to be looking at you. That way they know that they need to be requesting. So I will have the cow toy and it'll be like, oh, I want. And want to say it took my kiddo about a month, depending on the kiddo and their behavior. Some kiddos are stubborn, some learn a little bit faster. I want. They repeat, I want. Good job, I want cow. Although they're not required to say cow, you just want to add it in there because later on, now that they're getting the concept of I want, that's when another target of using I want in a complete sentence comes in play. So you kind of already want to teach them that I want cow. So when that target comes into play, they're like, oh wait, I already know this, you know? So I want cow, like good job, here you go. We call reinforcement, which is we like to praise the children. We like to give them their reinforcement, which is the cow in this case, because that's what they want. I want cow. And you just give it to them. Simple as that. Later on, the I want cow comes into place. Again, you grab it. I want. After they say I want, that's when you say cow. Cow, depending on how long they take to respond, which is called the latency response, we give them a little bit of time. And then after say cow, good job, I want cow. Here you go. It's just simple as that. You just give them their reinforcement.